Clinical case reports represent up to a third of the current literature. They are the easiest articles to get published. A clinical case report is a descriptive study which describes either a normal presentation or an atypical presentation of the patient. Alternatively, it can present an abnormal treatment response, be it medical or procedural. A case report might contain up to 4 cases that share the same particularity. Clinical case reports have a standardized structure. Firstly, there is the introduction. Here, the current understanding of the pathology is presented alongside with the common presentation in the population. It is complemented by a review of the current literature on the pathology. During the second part of the introduction, the author focuses on how the case differs from the norm in its presentation or in its response to the drugs. The introduction's ending leaves the reader with some hypotheses that underlie the atypical presentation. The second part is represented by the clinical case itself. During this section, the physical exam, symptoms, as well as laboratory findings of the patient are presented. Alongside them, imaging is added, as well as the assessment and plan, the therapeutic result, and the prognosis are mentioned. It is highly important to sift through the information, leaving only the atypical signs and symptoms, the atypical imaging or laboratory findings. The discussion session has the greatest importance in publishing the clinical case report. In this section, the hypotheses that underline the atypical presentation or the atypical response to therapy are presented. Thus, the author expands on the tease made in the introduction. Each theory is marked by a subheading. For each subsection, the mechanism that underlines the theory is explained. The conclusion is used to reinforce the particularities of the clinical case. The atypical presentation is presented in comparison with the norm. Thus, the importance of the clinical findings as well as the atypical response to therapy is emphasized. If you want to receive a weekly newsletter discussing USMLE related topics, send an email to medicalperspectiveblog@gmail.com. Firstly, the clinical case section demands precision. This means skipping the non-relevant details. You will present only the atypical symptoms. For both explanatory reasons as well as better comprehension of the pathology, include as much detail as possible. For instance, for an atypical symptom, include as much as you can on the laboratory findings. If the patient had a marginal coronary that provided irrigation instead of LAD, then provide as much imaging as possible, coronarography, MRIs. Before starting a clinical case report, make sure you have a database on the current literature on the pathology and its normal presentation. In the case of adverse drug reactions that can be atypical, you can consult the FDA or the EMA sites. A good rule of thumb is to take at least 3 articles for your pathology, as well as 3 articles for each theory. These articles would better be a literature review or a systematic review to have a more comprehensive view. For the post mechanism is more plausible with more Hill Evans criteria fulfilled. To check out all the 9 Hill Evans criteria, look at the link in the description below. The objective of demonstrating how Hill Evans criteria are fulfilled in your patient is to give more support to your hypothesis. 5. As Benjamin Franklin noted, failing to plan is planning to fail. The plan in our case is an outline. The outline helps guide you through the writing process. Thus, you can summarize each paragraph through one idea in the outline. Then, from that idea, you will expand into a fully fledged paragraph. The idea from the paragraph not only encapsulates the gist of the paragraph, but also serves as the first sentence of the paragraph. Here, a digital outline is better than an analogous one. The advantage is that you can add the references directly to the outline. For apps that come in handy in this process, check out Zotero or Mendeley. The last tip is that a brief conclusion is better than a long-winded one. Although numerous authors prefer a long conclusion, it is better to restrict yourself to only 2 paragraphs. A good rule of thumb is 5 sentences per paragraph. Now that you know how to write a clinical case report, it is up to you to find research. Check out this video.